Ever stood at a patient's bedside, looked at the monitor, and thought, okay, but what do I actually do first? If your brain freezes in those moments, you're not broken. You just haven't been taught nursing decision-making in a way that actually sticks. Let's fix that right now. In the next few minutes, you'll learn what nursing decision-making really is, why it matters at the bedside, the simple steps nurses use to think it through, and a real patient example that ties it all together. No heavy jargon, just a clear, beginner-friendly breakdown you can use on your very next shift. So here's the thing. Nursing isn't just about following orders or memorizing facts. Every single shift, you make dozens of judgment calls. Which patient do I check first? Is this symptom serious or normal? Do I call the provider now or wait and watch? That skill has a name: clinical decision-making. And whether you're a brand new student or a seasoned nurse, getting better at it makes you safer, faster, and a whole lot more confident. This is the core of strong clinical skills, and it's something you can absolutely learn. Let's keep this simple. Nursing decision-making is the process of gathering information, thinking it through, and choosing the best action for your patient. That's it. You collect clues, you weigh them, you decide, then you act and check the result. Here's the catch most people miss. It's not a one-time choice, it's a loop. You decide, you watch what happens, and you adjust. Good nurses are constantly looping through this cycle, sometimes without even realizing it. So what? Once you see decision-making as a repeatable process, it stops feeling like guesswork and starts feeling like a skill you can practice. Let's break the process into 4 plain steps. First, notice. Pay attention to your patient and the data. Vital signs, how they look, what they tell you, what feels off. Next, interpret. Ask yourself what these clues mean together. A heart rate of 1 out of 10 might be nothing after a walk, or it might be an early warning sign. Context matters. Then, respond. Choose your action based on priority. What's most urgent? What keeps the patient safest right now? Finally, reflect. Did it work? If yes, great. If not, you loop back and try again. Notice, interpret, respond, reflect. That's your mental checklist. Most beginners jump straight to respond and skip the noticing and interpreting. The better approach is to slow down on those first 2 steps. That's where the real safety lives. Why does this matter so much? Because patients change fast. A small detail you catch early can prevent a major problem later. Strong decision-making is what separates a nurse who reacts to emergencies from a nurse who prevents them. It protects your patients, and honestly, it protects your license too. And here's the encouraging part. Experienced nurses aren't smarter than you. They've just run this loop thousands of times, so it feels automatic. Every shift you work is a rep. Every decision you reflect on builds that instinct faster. Let's make this concrete. Picture this. You walk into a room for routine vitals. Your patient, recovering from surgery, seems a little more confused than this morning. Notice, something's different. You check the data, blood pressure is slightly low, heart rate is up. They're breathing a bit faster. Interpret. On their own, each number isn't alarming. But together, this pattern could point to early shock or bleeding. So you respond. You don't just chart it and move on. You stay with the patient, you escalate by calling the provider, and you prepare for next steps. You act on the pattern, not just one number. Later, after treatment, you reflect. The patient stabilizes. You caught it early because you trusted the full picture. That's nursing decision-making in action. You connected the dots before the situation became a crisis. So let's lock in the key takeaways. 1. Nursing decision-making is a loop, not a single choice. You decide, observe, and adjust. 2. Use the 4 steps. Notice, interpret, respond, reflect. 3. Act on the full pattern, not just one isolated number. Master those, and you'll move through your shifts with far more clarity and confidence. If this finally made nursing decision-making click for you, do one thing. Subscribe and keep learning with us, because we break down clinical skills and nursing education into simple guides just like this one. Let's learn from each other. See you in the next one.